Welcome everybody to our call for May. Hope you all had good bank holiday weekends. I notice it's not anyone's first time on the call, so I won't say that normal bit. Um, but we are going to be talking today about this month's campaign action, as always, which is going to be on the topic of tuberculosis, but more on that later. So as usual, just the usual housekeeping messages. Please do keep yourself muted. If you've got any comments, I'll be trying to keep an eye on the chat box. And as always, we'll be recording the call. So if you don't want to be on it, do feel free to turn your video off. And we'll be keeping the call open as we sort of become accustomed to for an extra half an hour or so, if anyone would like to chat informally afterwards. So does anyone want to say hello? Um, not obligatory. So we're going to have a slightly different format for this month's call. So normally you have me giving a bit of spiel about the things that are going on in the world that affect our work, and then Aurora would share updates from the network. Now, Aurora has recently left results, and obviously we wish her well in her next steps. I know many of you worked closely with her, and she's been a really brilliant supporter of the grassroots network, and I know she's been very committed to all that you do. So I will be sharing the updates for this month, and then we'll have not one, but I was going to say not one, but two speakers. We actually have one real and one fake speaker. So I will introduce them and what that even means a little bit later on. We've got a recorded message, but I'll explain why and how that will all work in a minute. So I will start, if that's okay, by my usual sort of roundup, and I will try and keep it short. So firstly, as you all know, since February, we've been trying to we've been thinking about reaching parliamentary candidates if you're able to. Obviously, despite the local elections just this last couple of days, we still don't have that date for the general election. And so it is still a worthwhile opportunity doing this if you have the opportunity. Just to, contact them about any of the global poverty issues that you care about, and our action materials specify a few talking points if you need them. Over 100 MPs are standing down this time, which means that a whole new intake of parliamentarians will be in position of influence, and some of those are going to be government ministers. So it really does help if they've heard from people in their constituency about the issues beforehand. So I am going to just put that link back to those February action materials in the chat, should anyone need them. And there we go. For those of you who would find it helpful, and I don't know if you would, but the results parliamentary team has agreed to contact each results group individually to offer tailored advice on how this might look in the constituencies that you cover. So I'll be introducing you to them in the next few weeks, and I hope you'll enjoy meeting them. So that's something that is an offer should you want it. Also on sort of parliamentary topics. Results UK, as some of you know, hosts a thing called the International Parliamentary Network on Education, or IPNED. And last Tuesday, they released a very important toolkit on school meals, which are crucial around the world, not only for ensuring good nutrition, but also because of that, through helping children to benefit properly from attending school. So this resource that they've created is intended to help parliamentarians around the world advocate for those kinds of programs. And again, I'm going to put the link to that in the chat box. I mean, I know we haven't done an education action for a little while, but some of you might find that interesting as well. Also last week, which was a very busy week, we had World Immunisation Week. And we organised an event in Parliament for the all-party parliamentary group on global vaccinations. So this year, it is apparently the 50th anniversary of global cooperation on immunisation. And we celebrate the fact that vaccines have saved 154 million lives in the past 50 years. That's a staggering number. It's kind of hard to get my head around, but in 2024, what that means is that a child younger than 10 years old is 40% more likely to survive to their next birthday compared with a child born 50 years ago, which I think is kind of quite astonishing, really. Um, so I'm going to put a link to where you can find that statistic and others just in the chat box as well. We're not talking about Gavi quite this month. We have a replenishment of Gavi coming up, but that hopefully that information will be useful to you. So we'll be calling on the UK to make a big financial pledge. It's now, I think, believe it or not, four or so years since we've asked you to do that the last time. And as many of you know, Gavi is an international partnership that helps vaccinate more than 1 billion children, or has helped vaccinate more than 1 billion children in 78 lower income countries, preventing more than 17 million future deaths. So we'll be in touch with you about what that means and how you can support global vaccination efforts later in the year. But for now, I will have one more thing to share on vaccinations in the chat, which is a blog post from our office intern who was called Reese. She joined us for a few weeks, a couple of months actually, from Florida, and writes about the risk of vaccine hesitancy in where she comes from, but really links it to the issues that we work on and why it's really important to overcome this and to make sure that people believe in the importance of vaccines at this time. So again, I'm just going to put that in the chat and you can pick it up as and when if you're interested. So that's it for the staff updates. Oh, Abbas is in the waiting room. There we go. The kind of things that we've been working in the office, but I do want to now move on to the things that you've been doing. I probably missed some. So firstly, congratulations to the pool group for your activity at a local event called the Smile Fair last weekend, talking to local families about the Sustainable Development Goals. And I gather they were colouring in activities for children. And good luck to the Scotland group who are also planning a stall at the Meadows Festival in Edinburgh at the start of June. So hopefully we'll be able to maybe hear how that went at next month's call. So I don't know if anyone from Scotland or Poole wants to unmute and say a little bit about those things.
Okay. We have one question for you, Naveed, which is there a call on the 4th of June?
At the moment, yes. I'm planning that there is. Sometimes it's a bit difficult when it comes at the same time as the conference, but I think we'll be able to manage it. If that isn't true, I'll let you know. But yes, we're planning at the moment for there to be a June conference call.
So we're going to stand around in the Meadows Festival, which is not as big and globally famous as the Festival Fringe, but is brilliant nonetheless. And I'm hesitant to say any more about it because it's Kathy's brainchild. So I'm hoping Kathy will come off mute and blow her own trumpet.
I won't blow my own trumpet, but I will say that if it's good weather, it can be a great event. But we will report back both on the weather and the success because I think they're very linked. So we'll see what the 1st and 2nd of June will be like. Keep your fingers crossed for us.
Will do. And thanks to all of you for those efforts. Did anyone from Poole want to have a word? Oh. Well, thank you for organising it. Saw a couple of lovely photographs of your stall, which is really nice. So I was also asked to attend a meeting a couple of weeks ago now. Is Kemi on the call? No, she's not. But Kemi is organising, so from the online group, trying to get a group going in Derby University for the start of the next academic year, which is very exciting. So really wishing her well in getting this off the ground. And also to Ravi, who is new and I think was on last month's call. He's in Brighton and is also to hoping to get some local advocacy going in Brighton. And so those two things are hopefully also getting off the ground as well. So fingers crossed, and obviously from the office, we'll do everything we can to support those kinds of efforts. A massive thank you to everyone who's contacted the FCDO on the polio eradication campaign. Thanks to everyone who's shared with us that they've written a letter, including Jill, Pete, Angela, Tony, and apologies if I've missed out other people as well. And thank you, Tony, for sharing your letters to your parliamentary candidates as well. That was really great to see how you kind of expressed your concern about global health issues. So thank you for that. We've also continued to hear the letters have kept on coming in about the March actions on TB. Again, we've had a really impressive response to that action request and some interesting responses from the Minister, from Andrew Mitchell. I don't know how many of you have got a reply yet, but I actually got a positive response from my MP on which mentioned drug-resistant TB and AMR, antimicrobial resistance specifically. So it was a relatively detailed letter, I would say. It was quite good to see. Also, congratulations to Jill on getting yet another article published. I think that's about 3 or 4 now in the last month and a half. In the online magazine Independent Catholic News, and that was for World Immunisation Week, again in support of the polio action. So Jill, thank you very much, and well done on your winning streak. Lastly, I would just like to urge you to sign up to what we're calling our summer gathering on the 9th and 10th of June. Now, sadly, because of our staff capacity at the moment, we've been unable to organise the usual full 2-day conference with speakers and workshops. I know that's going to be quite disappointing to some people, but it was just, we kind of ran out of time and didn't have the speakers, and we had to just make a decision. But we do think it's super important for us all to meet together face to face. So we're going to hold a 1-day get together in which we'll be able to talk about things like results. Results is advocacy. We can talk about our issues. We can talk about the issues we're facing as a network and recruiting new people, all of those kinds of things, whatever it is that you'd like to talk about. So do have a think. And we'd love to see as many of you as we can in London on Sunday the 9th. Then on the Monday, we've got the usual advocacy day, which we will still run. And we have got 3 meetings confirmed already. So 2 FCDO ones and 1 parliamentary one, and we'll have the usual kind of breakfast briefing in the results office for those of you who've been on it before, and then people head off to those advocacy meetings, starting off with Whitehall. So I've just put the links to that and a sort of flavour of last year's kind of gathering style event, the Sunday of our national conference from last year, in the chat, so you can get a feel of what it is you'd be signing up to. Does anyone have anything to add from around the network before we move on to the topic of our conversation for this evening? Jill, go for it.
Yeah, I know at last year's gathering, as it were, on the Sunday, I was banging on about getting faith groups involved, and I'm pleased to say that we seem to be mobilising. I went to a Zoom training event run by CAFOD, which was absolutely brilliant, and they've teamed up with an organisation called St Vincent de Paul that are concerned with poverty in the UK, and the 2 groups have put together a toolkit for talking to your candidates with a lot of really useful information. And they've got 8 areas, and they ask you to choose 3 at most, and to get other people involved in going to hustings and all sorts of things. And one of them is on international development. And there's 2 very good questions there. So that's on the CAFOD website. I'll put a link to it because it was really good, and there was 130 people on the Zoom meeting that I went to, and
Wow.
they'd had the same number earlier on in the week in the evening, so they're hitting a lot of people. But it was really good materials, and I think that should be on the go now. That's from the Catholic perspective.
I do think even if we're still in for an autumn election, that the time will whiz by, and it is definitely not too early to do that kind of stuff. Thank you for sharing that.
Okay.
Thank you also for putting your link to the article for World Immunisation Week. I can see that that's gone into the chat as well. So I think it's time for me to explain my cryptic remarks as us about having one real speaker and one fake speaker. So we are going to be talking about TB. As you know, as we mentioned last time, we've got a brand new, really important, I think, report just launched called Stigma Kills. And the author, Sahira, is on the call. I can see her here. There she is. Thanks for joining us, Sahira. So rather than what we're going to do, we planned something that sort of came a cropper about an hour ago. So the idea was that Sahira was going to talk about the one of the significant kind of policy recommendations for the report. We were going to have kind of questions about that, kind of in the usual way. We wouldn't kick off with the normal kind of pre-prepared questions, but you can ask your questions in the normal way. Then we were going to make time for a second presentation from Vinny, who, again, some of you know, who's a senior parliamentary advocacy officer on TB, so complementing Sahira's senior policy role on TB. Unfortunately, we just discovered that he's got childcare issues, and so he was unable to join us. He says he'd be lurking in the background, but he's unable to have his audio on or video on, and I can't actually see him lurking at the moment. So what he's kindly done is he did a short audio clip of him talking about what he was going to talk about, and he's done some slides. So we've kind of got an automatic fake Vinny for you. I don't know how this is going to work, but we've got him talking and we've got some slides. And what he was going to be talking about, and hopefully will be in sort of partial absentia, is the idea of asking your MP, crafting parliamentary questions for your MP, rather than just asking your MP to raise an issue in whatever way they want. So it's a bit of a new take on that activity, and we'll try and get the technical side of things to work so we can play his slides and his audio and not lose you all at the same time. So fingers crossed, because you're going to be reliant on my somewhat negligible technical skills for this one. If that hopefully that will make sense, but do keep questions going in the chat. I can still see the chat at the moment, and before we get into it, I'm just going to ask Sahira, because I can't ask Vinny, but just to introduce yourself, say hello, and remind people, or for those people, some of them won't have met you, just to say hello and how you got into advocacy on TB with results.
Yeah, hi everyone. Great to see you again. I have seen some of you in person, so it's really great to be back on another grassroots call. My name is Sahira. I'm the Senior Policy Advocacy Officer for TB, and I work in the policy team. I've been at Results for about a year and a half now, and my background is in public health. Before I came to Results, I was working for the NHS. So I've worked both at a local level, working on health inequalities, on kind of health equity projects on a local level. I've also worked in mental health at Leeds Mental Health Hospital. And then more recently, I was working at NHS England, working on policy programs for cross-border health, diabetes, and then respiratory disease as well. So I worked on the NHS long-term plan, which came out just before COVID happened. So I'm really passionate about health inequalities, reducing equity, and I kind of always wanted to kind of move into more global health related issues, which is why I'm now at Results here with you guys tonight. So that's me.
Thanks, Sahira. So yeah, as I say, we've launched the Stigma Kills report on World TB Day, before, in fact, last month. We flagged it up, but we thought rather than expecting everyone to go and read it, we'll actually try and bring to life a few of the issues from it. So it's really all about how we need to have a whole of society approach to TB, which Sahira will explain now, and how just a medical response, which we're all very, very familiar with, I think, on this call, is not the only thing that we need to do. So I'm going to ask Sahira to speak for probably about 10 minutes, and then we'll have time for 10 to 15 minutes of questions, and then we'll see. I have to play it by ear a little bit, so I need to leave time, 15 minutes or so, for the fake Vinny and the parliamentary questions bit. So let's see how it goes. Over to you, Sahira.
Yeah, thanks, Naveed. Yeah, so like Naveed mentioned, we launched the report in March, and the report is about developing policies and interventions that target the root causes of TB, so such as poverty, undernutrition, stigma, lack of access to healthcare, for example, all the issues that some of you will probably already be aware of. And the main focus is around taking an equity-based approach. So this is about ensuring that all people have access to the interventions that they need, and the people that are the most marginalised by society, such as vulnerable groups, so people who might be in poverty, migrants, people in detention centres, for example, they've got the same level of access and care that the general public would have in those circumstances. The report is kind of broken down into a few sections. There's a big focus on health equity, then looks at a whole of society approach. There's a chapter on making the economic case for TB, a section on stigma, and then a last chapter on our research and development as well. And although it is a long report, because it's broken down into the sections, you can just kind of go in there and take bits of information that you need if you're writing your letters or your articles. And I know Jill's already kind of been in there already and taken bits of information, used it for her articles and letters, which has been really helpful. And if you ever need any kind of more information, obviously feel free to contact me directly. So in terms of why the report is out and the need to kind of focus on a social approach for health, the way we treat obviously TB and a lot of diseases is we are very focused on the drugs and the medication to treat the physical disease, and that's the correct way of doing it. But we've become so reliant on the medical model that actually we forgot about everything else. So we're not taking into account the person's nutrition, what their social environment is, are they experiencing stigma and discrimination. We're just so focused on, okay, they've got this disease and this is the drugs that they need to treat them. Off we go, there it is, that's the end of it. And then we wonder why people are unable to continue treatment because they can't get to a health centre, or they can't finish the treatment because they don't have access to the right nutrition, or they've been discriminated against, for example. So all these kind of factors around healthcare, such as the social determinants or social factors, actually play quite a big role in people being able to access healthcare, and then if they are in healthcare, to access the right treatments that they need and to be able to continue and successfully finish those treatments. So if we take nutrition, for example, as a basic kind of factor, obviously undernutrition is a major cause of someone being able to develop TB, but it's also a factor in someone being able to successfully recover from TB. So even in countries where the where the medication and the treatment for TB is free of charge, people are not always supported with the nutritional packages that support that. So in the report, we talk about Côte d'Ivoire, so Ivory Coast is a country that is funded by the Global Fund, for example, for their TB treatment. And although the drugs are free, they don't actually support everyone around access to food packages and nutritional support. So people might be getting the treatment for free, but if they don't have enough nutrition or anything to eat, they're not going to get the full benefit, and actually they might not recover fully from their TB, and that can also lead to other issues within their health and well-being. So this is why we need to take a holistic approach to ending TB. So we're looking at how we can work on the social factors alongside the medical factors to make sure that, one, people are at reduced risk of developing TB in the first place, and if they do get TB, that they have a full holistic package of support around them. So, for example, poverty obviously is a major issue in people developing TB, and we know that from all the evidence kind of points to that as well. So, for example, if somebody had to take time off work and they're in the informal work sector, they're not always going to necessarily want to have to take time off work to go get their medications or to get tested or to have follow-up treatments if there's no kind of compensation for that, if there's no kind of social protection in place to help that individual, especially if they're maybe the main income earner in a family, for example. So all these factors surrounding the reasons why somebody might not be able to continue their treatment are just as important as being able to have the right drugs to treat the disease. So when we talk about a whole of society approach, it's about addressing the whole kind of root causes of what TB is. So talking about a whole of society means involving everybody in a society. So you've got your health sector, you've got your individuals, civil society, your businesses, it can include the government as well, and families, and even the media. And what this does is it brings everyone together. So it looks at all the factors that might be causing TB or affecting somebody's treatment, and having interventions for all of those in place. So obviously the health sector alone can't address, somebody's poverty or their housing issue, for example, but it can look at other options around social protections, which I'll come on to separately. And having a whole society approach is kind of building on what a whole of government approach is. So within the government, if they're working on health policy, for example, they need to look across health, across education, across the environment, to make sure whatever policies they're putting in place is not going to have an inadvertent knock-on effect on something else, for example. So if somebody is building some housing in an area, okay, that's a positive move. In the short term, it's going to cause a lot of pollution. It might affect access. It'll obviously be a lot noisy. It might affect kind of other areas, other issues in that particular area, for example. So having a whole of government approach first is actually quite important to building on health policy issues, and then taking that further, you look at a whole of society approach. And we already have the basis of some of these within TB. So we have a multi-sectoral accountability framework, which was developed after the first high-level meeting. So in 2019, it was developed by the World Health Organization. And what that does is it's a checklist of all the social factors that affect TB, and then looking at, have you got interventions that address these? And this is for all governments to use, and anyone can use these within TB programs, for example. And this was one of the things that we were actually advocating for at the high level meeting, that it's kind of mandated. So although we have it, it's not mandated for use, but it is there for use, and it does work kind of when it's been put into practice. And we did do a report on this last year as well. So that's on our website. But kind of coming back to the whole of society approach, it actually builds strength within communities when you have this approach. That it can help to influence and mobilize both communities and maybe the informal and formal sectors around communities that support them. So being able to get access to healthcare, or to get the drugs that you need, or even just access to the health centre, for example, can help people in being able to access those things that they need. And we also have the evidence to show that actually it improves health outcomes where you have this type of approach, and it's got the power actually to improve development overall. That's why sometimes we say it's good to see TB as a form of international development, because if you're making progress on TB, you're probably making progress on poverty as well, which is why sometimes TB is used as an indicator in terms of, do you have access to universal health coverage and primary health care? And it's a good indicator on development issues as well. And the other benefits around having a whole of society approach is actually improves social cohesion within communities. It improves equity, where everyone has the opportunity and access to the interventions that they need. And that in turn improves the economic conditions as well, which is why you get the kind of knock-on effect on improving development as well. One of the examples we put in the report, actually, because we don't really have any examples of where a whole of society approach has been kind of used well, is in the UK around childhood obesity. So the work that the government did kind of mid 2000s was working with a whole different bunch of organisations and sectors to address childhood obesity. So beyond education, health, looking at local councils, working directly with families, social services, for example, and taking that whole systems approach to, okay, where does that child kind of link to all these organisations, and working with them so everyone has a shared goal of what you're working towards, and they're putting all the kind of efforts and resources all into that same goal. And we've seen that, across health inequalities, where you've got that whole of society approach, actually it does work. And we've seen that in the UK as well, back in 2010 when that did happen. But then once the programs are finished and the funding's gone, actually you see inequalities, start to rise again as well. And so the action this month is looking at social protection schemes. So one of the recommendations in the report is kind of what was used in the political declaration. So the political declaration that we got at the end of the high-level meeting last year was where all the member states, including the UK, signed up to an agreement and some commitments within there. So there's some medical targets in there, and then the one kind of non-medical target is that we expect 100% of people who have got TB to be offered or have access to a social benefits package. And that's quite a big breakthrough in terms of what is actually written as a commitment and a target in a, in a UN document, because it actually has the power to really reduce inequalities and reduce inequities that, a lot of countries with a high TB burden face. So social protection schemes probably look different depending on what country you're in, for example. And I know for the UK, for example, we haven't done anything on this because I've asked the UK Health Security Agency and they've not been able to tell me anything that they've done. So I'm going to help try and put some recommendations, try and suggest what they might want to do. So this might be things such as financial support, like I mentioned, the nutrition packages. People might get vouchers to go to the supermarket, for example, to get healthy food. And in certain countries, obviously, they've got quite strict laws around people have to notify the government if, somebody has got TB, which obviously is very discriminatory because it shouldn't be used as, in that kind of context. So having some kind of guarantees that people can kind of get on with their employment and go back to work. There shouldn't be any risk to people losing their jobs just because they've got TB, for example. So obviously that's something that we can do in the UK. So for example, in the UK, where you have women who are pregnant from low economic backgrounds, they have what's called the Healthy Start voucher scheme. So they get access to these vouchers. They can get fresh fruit and vegetables from the supermarket or from the shops. And that's a system that's already in place. So you could include that if somebody had TB, for example. So yeah, there's many things that you can do with social protection schemes. And actually one of the things that the analysis that the World Health Organization has done is actually if you implement these schemes within TB programs, you could reduce the TB incidence by 76% and actually reduce poverty and susceptibility to poverty as well. And that's on a global scale. So that's quite a big, that's a massive difference that if we were able to implement that in all countries, the rate of TB will actually come down. And that just shows the really strong link between TB and poverty and why having a social benefits, a social approach to TB as well as the medical approach is something that is really needed. I'll stop there because I think I've just gone over my time, but happy to take any questions.
Thanks, Zahira. That's a really great overview of the report and some of the issues that come out of it. Did you say 76%?
76%. This is WHO evidence.
I think that's a figure that a lot of people would be quite surprised by how high that is.
Exactly. It is really high, yeah.
Well, yeah, thank you for that overview. I'm going to open it up to questions and we'll have sort of 10 minutes of questions. I've seen there's a couple in the chat, first of all. Firstly, Jill's mentioned that the sort of multi-sectoral approach has been used successfully in Myanmar to reduce the TB burden. I'd be interested to know more about that. And Pete's got a question about what mechanisms there are to monitor and to monitor and report on kind of multi-sectoral kind of schemes. I put a link in the chat to the multi-sectoral accountability framework that you mentioned. Is that thing, or are
yeah,
they
that's that, yeah. And that is that. I think Peter's put that. Yeah, so that the accountability framework that is monitored by the World Health Organization, and in their annual report on global TB, they will report how many countries have implemented it and are using it as well. So obviously that they can only report on if countries have reported that information back to the WHO. So there's always going to be a little bit of kind of missing information, but yeah, the WHO does monitor that. And as global health TB advocates, we are pushing for that to be mandated. I have asked the NHS to be using it in the UK, but I've not got any success on that yet, but I'll still keep pushing with that.
Thanks, Zahira. And there's another question in the chat from Jill. Has the UK got a TB strategy? There used to be one, but we don't know if there is one now.
So we have a TB action plan, and that is going to be refreshed within the next year. So that's why I was asking if in the new one they can include the accountability framework. The problem with the action plan, though, it's not funded. So this is an issue, and actually our rates in the UK are increasing. So this might be a future thing to kind of look at as well.
Thank you. I kind of have a question actually. So obviously, we're working on a range of different issues and they sort of come and go month by month, but we try to come back and tell the story of where we're up to now and how the different bits of a campaign link together. And so, a couple of months ago, we asked everyone to sort of write letters on drug-resistant TB and antimicrobial resistance. And I was just wondering, it seems that if not having a social care approach or a whole of society approach is going to increase the rate of dropout of care and dropout of treatments, is that actually contributing to that issue we worked on a couple of months ago, that actually multi-drug resistant TB and drug resistant TB is increasing, or are they just not related?
Yeah, definitely. That's definitely the case, Naveed. So obviously, if people are started on treatment and then they don't finish it, obviously either they might die because they haven't been treated properly, or if it's normal TB, it then can, progress into drug-resistant strains. And obviously, if somebody else catches that strain, that's going to be, again, bad news for transmission. So yeah, if we're not tackling TB, it means drug-resistant TB will also increase, which will obviously have a knock-on effect of AMR. And we're already seeing with the new drug treatments that have just come in 2022, there is some resistance already to the new treatments. So this is actually quite a little bit scary that they were brand new and there is some drug resistance already, and that's just how fast the bacteria obviously is becoming very resistant to these things. So yeah, it will have a knock-on effect.
So that puts that 76% reduction in a bit of a different light.
Yeah.
It really becomes very, very important indeed, doesn't it? Thank you for that. Any other questions? Got a good amount of time still for questions. Kathy Geverett.
Right. I'm just wondering, I know that we're talking about sort of a whole holistic and whole society, but how much of TB is sort of ghettoized, and how much is it like areas that are known for people to be, there's TB in that area, don't live in that area if you possibly can avoid it. And is that even whether it's true or not, and how infectious TB actually is that a big issue in the whole problem of how to get a whole society approach to coping with TB?
Yeah, do you mean in the UK or just kind of generally around
In
kind of living?
worldwide generally?
Yeah, so obviously if people are living in, kind of poor housing or poor living conditions with kind of little access to water and sanitation, for example, that will definitely increase the risk of somebody developing TB. And because you're living so close or in overcrowded conditions, if one person gets TB, obviously there's a very high risk, then it's going to kind of transmit quite quickly. And we have seen that in India, in some of like the way the flats were made, because there was no ventilation and people were overcrowded, there were hotspots of TB and where it was spreading quite fast. So definitely where people live is an issue. And yes, as you have said, it can then cause people to be discriminated against because they know they're from a certain area, or that people in that area have got poor housing, so they've led to TB. So there is still that stigma that is attached with TB because of where people might live or because they're in poverty. So that is still an issue, and that's why we still have to be increasing awareness, do desensitizing training with healthcare professionals, for example, to make sure at least the healthcare providers are not being the ones who are discriminating people with TB, for example, and then working on the actual, the general public to destigmatize TB in general, which I think we've still got a long way to go, unfortunately, with TB.
Thank you.
Thank you.
Thanks for your question.
Let's have another question, and then we probably move on to the next bit. Okay, so one of the things that I think came out of particularly the title of the report is about stigma, and I think that's something that quite a few people on the call do know about. It's an issue in relation to not just TB, other disease areas as well, but particularly TB and the infectious side of the disease. And so we've been really thinking hard about how to make sure that we can get the stories of people to help us understand what that's actually like, because it's not just something that it's not just a statistic, it's a person suffering from those kinds of things. We had a speaker at the event for World TB Day who was able to bring that to life, and that's one of the issues also that's come out of this report. So I thought I'd mention that just because it's such an important issue that often doesn't get covered enough. And so that's also there in the report. It's not exactly the topic of our campaign action this month, but it's a really important thing to understand as part of that overall social impact on a person with TB. So I'm going to move it on now. So this monthly action, as you've heard, we're trying to ask the UK government, and again, the target is our Development Minister, Andrew Mitchell, to look at basically the commitments that we made back in September and say, okay, how are we going to do that? We've said we're going to make sure that no TB patient suffers because of their illness, and they have that care that they need, that whole of society approach, that social safety net, but that obviously costs. How is that going to happen? So that's the kind of the next stage in the getting the UK committed. And I think it follows up your question, Peter, about what's the accountability around this, what's the kind of monitoring. So we need people to live up to the words that they've said in the international forums such as the UN. Very often, as I said earlier, we ask you to ask those questions through an MP, and I think that's what we've done this time. But we very often leave it to the MP to work out how they're going to ask that question. And on some of these quite technical issues where the MP is probably not very familiar with it, or certainly probably not as familiar as with the areas you are, they may well not know how to ask the question, or they you know, they're asking questions in Parliament all the time. But believe me, and believe my colleague Vinny, who knows these things a lot better, that actually those questions aren't always done in the most efficient way. And what we can do is ask them to ask a particular form of words, and that can really help the question cut through, get to through to the top of the list of the questions that go to the government departments. And so we're going to explore that now as a way of hopefully, it's a bit of an experiment, but to see if we can't maybe increase the effectiveness of how we get the message through to the FCDO. So we're going to put on a recording of Vinny, as I said, made not more than 2 hours ago, I think, and we're going to play his slides, and he's left me with instructions of when I need to press the button to move the slide on. So you've got a robot Vinny, but it'll sound real. Sadly, you won't be able to ask him questions. He still hasn't appeared in the waiting room. So I think we'll have to work on the assumption that we've got a presentation. Sahira and I can take some questions if we can, but we may have to pass them on to Vinny if you want more details of the parliamentary process. So I am going to share my screen so we get the presentation up. Can you see that?
Yeah, we can see it.
Yeah, great. Okay, so I just to work out how I can see you and that at the same time, which I can. And I also need to get up the notes that Vinny has sent me about when to turn the slides, and I've got that. So all we now need now is the audio Vinny. So bear with me a second. And can you wave if you can hear him talking?
Sorry that I'm not able to be there in person this evening, although I am lingering in the background for the question and answer session at the end. But I had unfortunately some last minute childcare stuff came up, which meant that I can't be there in person answering all your questions. But for those of you who've heard me speak before, and I should probably reintroduce myself, my name is Vinny. I am the Senior Parliamentary Advocacy Advisor for TB at Results. And I work in Sahira's team, so Sahira and I are a little double act, and we work on the TB portfolio. And those of you who've seen me speak before or have spoken to me before will all know that there is not a single opportunity to talk about Parliament that I won't pass up. And so obviously on the agenda tonight we had what I'm calling the art of writing parliamentary questions. So whilst I'm not able to kind of deliver it in a sort of live format, I thought I would pre-record it, and the benefit of having it pre-recorded, I guess, is that you've even then got a separate little bit of this meeting which you can go back to whenever you need it. And I guess the second benefit is that it's still light outside. Well, actually, it still will be light outside when you're watching this live as well. Sorry, excuse me. So yeah, I'm here to talk about parliamentary questions, which I think are one of the most effective ways that we can really quickly and really in a really agile way get answers from the government on a whole range of questions. So I put together this little presentation, which I'm going to talk through, and as I say, the slides and all that, and this video will be available if you want to use it again. And there are a couple of links which I'll ask Naveed to share in the chat as well, as we go along. So yes, the art of parliamentary questions. So what are parliamentary questions? Again, some of you who've seen me speak about this before for other results calls. So parliamentary questions are the mechanism by which parliamentarians ask questions of the government. And they come in two forms typically, written questions and oral questions. So oral questions are the ones that you would see on when you watch a Parliament TV, or maybe Prime Minister's questions is the best example of oral questions, where they're orally asked in Parliament, if the name doesn't make that obvious. But written questions is the one that we're concerned about today, and written questions are a lot more kind of behind the scenes. There's loads of them flying back and forth all the time, and the only time they're only ever really brought to our attention when I don't know, maybe there's a bit of an unusual answer or a bit of an unusual question, or when someone like myself or other people at Results do some digging about what the government believe on certain things. So as I say, one of the benefits of PQs is that they're answered really quickly. Well, I'll touch on this a bit later as we go on, but typically you can expect a reply from a government minister within 7 days, which is a pretty quick turnaround, especially for those who've maybe written letters in the past and you've been waiting 6 months or a year for a response from the government. I mean, I've definitely been in that boat before. But yeah, so this is specifically written questions. So the way that written questions work is that members of Parliament will send these very specific kinds of questions to an office in Parliament called the Table Office. It does exactly what it says on the tin. It's there to tables questions, it tables debates, but written questions will be sent to the Table Office. And then from there, if the question fulfills the criteria, which I'll discuss in a wee bit in a moment, providing it fulfills all the Table Office's criteria, they will then send them to the government department responsible for answering that question. We're in a team of civil servants, we'll do the research, and we'll draw up an answer. And that the answers can range from very detailed to very snappy. It really depends on the kind of question that you ask or the kind of person that you're asking it to. So, if you have maybe you're writing to a particularly tetchy minister, not that any of them exist really in the Foreign Office, to be fair, but you see some recently where they just get maybe like a 1-sentence reply and it's meant to be like a bit of a put down, but it's not very amusing. All answers to written questions are signed off by a minister. That minister could be in the Commons or in the Lords, but they all will be signed off by a minister, because obviously if the minister's name is going on it, they want some ability to be able to say what it says. They're not just going to kind of sign things off willy-nilly. There is a kind of quite rigorous process of sign off that they go through, but because they're only short, the turnaround is quite quick, as I say. And then, of course, all the answers from the government are then on the record, so we can go back, we can sort of go back in time and use that as part of our advocacy to say, or well, not even necessarily part of that. A lot of the time, the fact-finding exercises like how much is the government doing. I mean, I'll explain this a bit more as I go on. I shan't get bogged down in the detail here. So I thought a good way to start would be with some example questions. And you may see that the example questions that I've pulled out here are all from the same member of Parliament. That's because I wrote these questions back in my time working in Parliament. I was working for Stephen Twigg when he was chair of the International Development Select Committee. So I pulled these questions out because I wrote these questions once upon a time. I can't say I necessarily remember writing them all, but I wrote these once upon a time. So it's just to give a bit of a sense. I think even from just reading the kind of first couple of questions there, they're not it's not obviously how you would ask a typical question to to your mate or to each other. They have this very specific structure that you have to follow. So I'll jump into a bit more, but the more observational among you will already start to see the pattern. So the key to a written question, I guess the first stage of the written question, is to always begin the question with this: to ask the. And then from there, you expand the question out. So it's to ask the Chancellor of the Exchequer, to ask the Secretary of State for Defence, to ask the Minister for Rural Affairs. If there's a minister that responds to that portfolio, then you address it specifically to that minister. You can, I mean, a good fail-safe is the with, I guess, if it's FCDO questions, you can always just write to the Foreign Secretary. If you have I don't know, a question about defence, instead of finding the specific defence minister, just write to the Defence Secretary, and then they'll make sure that, I say the table office will then make sure that the question is allocated to the correct minister to respond to. So providing that you begin your question by saying to ask thee, then you're off to a great start. If you don't have to ask thee, then the table office won't question it. This is just the typical British parliamentary convention that we just have to follow. And as I say, even though it's written at the bottom here, you can't just address your written question to any minister that you like. So as I say, you can't ask the Defence Secretary about potholes. But the table office would reject that question anyway. But as I'll explain in a moment. So I guess, well, the next bit then is getting past the table office. So to go back to the earlier question, what we've got then is we've got the kind of first section to ask the Secretary of State for Foreign and Commonwealth Affairs, and then from there is what is the kind of body of the question. Once you've got the parliamentary formality out of the way in the first couple of words, then the meat of the question comes in. Then, so you see from this question, of how many experts the Preventing Sexual Violence and Conflict Initiative multidisciplinary team is comprised. Very specific question. Very, very specific question. So even though that was an example of a very specific question, you can ask questions about really whatever you want. If the British government is doing something in that area or is funding something in that area, then you're entitled to get a response from the government on it. But the key is getting it past the table office. So the table office is the gatekeeper for these questions. And if you can basically get the table office sign off on the first go, then you're saving the MP's offices loads of time. And I probably should have explained this earlier on, but I think the reason for kind of giving you this ability is that, giving you the framework to answer these parliamentary questions or to write these parliamentary questions just makes it that 1% easier for an MP to just copy and paste your question into into the portal in Parliament that they need to, and they'll answer it. It's just saving them that extra little bit of time that makes the process just a little bit easier for them, so it's more likely that they'll do it, because you're taking all the work. All they have to do is literally copy and paste, and most people in the 21st century can copy and paste. So how do you get past the table office? That's the first big, I guess that is the first and only big issue, really. So what are some of the things that just from my memory, these were some of the things that we would get ours pushed back on. So it's addressed to the wrong minister. As I say, asking the Defence Secretary about potholes, they will just reject that one. So make sure it's addressed to the correct minister and to the correct department, or you make it to the correct department, not necessarily the correct minister. The question is too specific, or the question is too broad, and you'll see I've expanded on this a bit below, because how can a question be too specific versus too broad? So I've just written these two examples off the top of my head. To ask the Chancellor of Exchequer why inflation has risen. That's such a broad question. The Chancellor isn't going to be able to sort of respond to that in a single paragraph. So the table office will push back and say that that's too broad a question. You need to be a bit more specific. But then equally, to ask the Chancellor of Exchequer how much money Liverpool Football Club received from the Exchequer for land drainage projects on municipal land between spring '84 and winter '94. Needlessly, public information doesn't exist. It's completely fictional, but it's too specific for them to be able to ever come up with an answer for. So you've sort of got you've got to have a fine balance between it being too specific and it being too broad. And I know that sounds very contradictory, but I'll skip to this bit first and I'll step back. But there is a great resource that you can use to work out to basically base your questions off, and that is the website in which all the questions and answers are published. So you can go back through any period. I'm not actually sure. I should probably mess around with how far in time you can go back, but I imagine you can go back based on Hansard. I mean, I only ever tend to go back to like 2015 or 2010. But all the questions and answers are published on the parliamentary website that I've got, and Naveed will post it in the chat for you. So it's a really good source of reference for other questions, or templates if you're looking for templates for other questions. You can use that as a good kind of introduction, even as a springboard. Oh, do you know what? I like the sort of look at that question. I'll copy and paste that. I'll just make a couple of changes to it so it's a bit more of the kind of thing that I want to ask. But it's a really, really good resource for being able to base your questions off. And as I said at the end, PS, it's a good way to check whether your MP has asked the question, because you can filter between questions. You can see questions that have been asked which haven't been answered. So it's a good way to kind of it's a good way to keep your MP on the toes about it. And of course, then you can search for specific MPs, what questions they've asked, what answers they've received, or specific departments too. And I guess answers. So yeah, as I said earlier, the turnaround is pretty quick. It's normally about 7 days, and all the answers are published on the parliamentary website.
I think that's finished.
Oh, can you still hear it, or did the sound go?
It is finished now, Naveed. It's finished.
Okay, so I thought could keep the sound going whilst the screen was off, and that was the one technical mistake I made. I was doing so well. So Vinny was just rounding up, and just following on from his point that you could check about which questions had been answered, which ones hadn't yet within that 7-day period. So I've just put the link in the chat box, and we'll make sure that Vinny's presentation. I wanted to say thank you to him, but he's just not here. So we'll make sure that that is available to you. And I'm kind of happy. I think that we've tried to squeeze 2 things into one call. Might not have worked, so let us know how that went for you. But any thoughts or any questions that you want either of us to take back to Vinny about this kind of parliamentary questions, because it's a bit of a new one in terms of the way we're suggesting that you raise issues and get them through to the minister. Not compulsory to do it, but it might just help. So let's just see if we've got some time for a question or two. Kathy, you've got your hand up.
Yeah, I mean, I get from my MP, because on the They Work For You website, I get all the questions that he's asked and the answers. And what frustrates me incredibly is he asks a useful, intelligent question, and the answer comes back in this bland, oh, well, the UK is strongly in favour of goodness and anti-poverty, and we do everything we want to stop that. And it doesn't actually, I mean, there's always a thing at the end of that. Do you feel this answers the question? And in at least 50% of the cases, the answer I have to tick is no, it hasn't answered it. But what do you do after that?
Yeah.
That's my, I think Vinny is much more positive about questions than I am, but that's just a comment.
I guess it's part of the game, isn't it? I mean, I don't know. And if we had him here on the call, we could ask him the question. We can find out. It's like, is that bland response more or less likely through a parliamentary question than if they've got to respond in a sort of the same kind of, still his department or her department that writes the response, but then it has to go to an MP who then send a letter back to the constituent. Does that make a difference? I don't know, but we can find out. Jill.
Will we be getting those slides from Vinny, because there was a lot of useful information there?
Yeah, apart from the last 15 seconds, which I cut off, it will be in the recording, which will go online.
Yeah, is it written down anywhere?
I guess so. I'll ask him. Yeah, he must have had a transcript because
it'd be useful to have it to be able to look at.
I will ask him.
Thank
you. any other thoughts about what we've heard in terms of? I mean, feel free to trial that this time, you know. But yeah, any other thoughts, Ricky and Karen? You've got your hands up.
It felt to me very similar to the freedom of information process, that Vinny's questions tended to be very specific with, you know, a fact of some kind as the answer. So I could see that it would be brilliant for a researcher. I would quite like to hear Vinny's comment, or yours or Sahira's comments on how to use that effectively as a campaigner.
Sahira, do you have any thoughts on that one?
Yeah, one of the things I know that me and Vinny kind of like to use on is things that the government have already said that they're going to do, and kind of holding them to account, because they can't really get out of that. So things that they've signed up to, either like from UN declarations or commitments that they've made in public, and being able to say, okay, what happened to X, you know, amount of money that was pledged for, you know, whatever kind of issue it was, for example, and then using that as a way of kind of holding the government to account for things that they say that they've agreed to, or that they've signed up through declarations or other agreements, for example, but you know that they haven't actually delivered on. So it could be used for that.
Great, thanks, Sahira. Well, thank you to Sahira for the first part of the evening, and to Vinny in absentia. I'll make sure that your thanks and comments are passed on to him. And really great that he was able to do that for us, because otherwise he was just, unfortunately unable to join us right at the last minute. So I hope that's been helpful. We can come back to this questions thing, see how it goes. Maybe have the real Vinny next time, or in a couple of months, we'll see. And yeah, we'll see how it goes as a sort of a slightly different take on our usual campaigning tactics. So I think we've got to call it a day now. It's just gone 9 o'clock. So as always, we'll be posting the recording of the call on the website. And the next grassroots conference call, as I said earlier, will be the fingers crossed, the first Tuesday of June, and we'll send the materials out in the normal way, and the conference call login details. So that'll be just before our summer gathering. That's the Tuesday, the 4th of June at 8 p.m. So thank you for being with us. Hope you've enjoyed this slightly different format. And if you're not staying for the informal chat towards the end, enjoy the rest of your evenings. And if you are staying, we'll chat.